Hi there, and thanks for joining us. I'm Connie Tran. Most people who get COVID-19 will recover just fine at home, but some will require hospitalization. Doctors at Community Regional say a small percentage of critically ill coronavirus patients may have to go on the ECMO machine, a treatment that requires a specialized team and helps patients' lungs and heart heal by circulating blood outside the body and pumping it back in. Hear one man's story of survival.
It is nothing short of a miracle that Almufo Sanchez is sitting here today holding his wife's hand. Sanchez is from the Central Coast and was diagnosed with the coronavirus just a few months ago, but he quickly became severely ill and was transferred to Community Regional for a higher level of care.
He clearly failed all the conventional therapy, and he didn't have any other chances. His lung was completely failing. The infection was overwhelmingly in his lung.
Dr. Mohammed Fayed with UCSF Fresno works in the pulmonary critical care unit at Community Regional and says Sanchez had nearly no oxygen in his blood when he arrived.
You can see him, he's blue. So he was very, very sick at that time.
Dr. Fayed says Sanchez's drastic decline in health speaks to the devastation of the coronavirus.
Well, it's really a difficult disease because we know when the infection happened to the lung, most people recover on their own, but we know that 20% of these people can get really sick. 15% will require hospitalization, 5% require ICU. And the subset of the people who are requiring ICU, the ICU level of care is not enough, meaning conventional mechanical ventilation is not enough for them, and therefore the next step is ECMO.
In a last effort to save his life, Sanchez was placed on ECMO. ECMO stands for extracorporeal membrane oxygenation, a way to put oxygen in the blood while bypassing the lungs.
Primarily what it's doing is the work of the lungs. It's taking blood that is unoxygenated and putting it through a circuit, an oxygenator, and oxygenating the blood and returning that blood to the body.
Dr. Robert Stewart is a cardiothoracic surgeon, just one of almost a dozen healthcare workers at Community Regional who make up the team who lead and administer the ECMO machine. Dr. Stewart explains it takes a large multidisciplinary team to successfully execute the round-the-clock ECMO treatment on a patient. Community Regional is the only hospital in the valley with this kind of excellent and comprehensive care for adults.
It's myself or a cardiac surgeon. It's an anesthesiologist and an anesthesiology tech. It's a perfusionist, and it's at least 3 nurses, a scrub nurse and 2 circulating nurses.
Both doctors say Sanchez would have undoubtedly died had it not been for ECMO. He spent weeks in the hospital fighting for his life. He shared a few words with us, saying he has no words for the care he received at Community Regional, and there were doctors and healthcare workers who gave him encouragement to look ahead.
Receiving patients from outside hospital are very important to me because I want to make sure that everyone can get the opportunity to receive this kind of treatment for this infection.
Though it's Sanchez and his family who are grateful for the outstanding care they received at Community Regional, Dr. Fayed and Dr. Stewart say they are the ones filled with gratitude to be able to treat and save COVID-19 patients.
I'm so pleased that each of these patients can get that chance again. I'm very proud to be part of this team. I'm very proud to be at a Community Regional Medical Center, especially at this time, and to offer this service to the entire Central Valley.
Sanchez says he looks forward to reuniting with his children and his wife. He knows now the power of never giving up on hope and life.